If you feel imbalanced, twisted, like you're buried into one side, or you have significant muscle imbalances, no doubt you've tried the classic stretch and strengthen method, and it probably hasn't worked. Or maybe you've been told that everyone presents with the exact same imbalanced pattern, and you've pigeonholed yourself into these exercises, but you know deep down you don't always fit that bill. We're going to disprove common misconceptions surrounding imbalanced posture and muscle imbalances, and I'll reduce all of the confusion as to what is exactly going on with your posture. And if you stick around to the end, you will get some movements and exercises to help make you feel a little bit more symmetrical. But before I do that, we have to clear the air and recognize that it is normal to be asymmetrical. According to these studies, everyone, based on their internal organ anatomy, has a rightward rotation throughout the spine. So if you're someone who has been diagnosed with a scoliosis, or you feel somewhat asymmetrical, recognize to some extent this is normal. It's no different than hand dominance. Many of us are right-handed or left-handed, and we can't do things equally on both hands. So too is it with the way we move. We have to be okay with not being perfectly symmetrical. But if you're someone who has pain, tension, or discomfort, then we can look to improving on this asymmetry. But one thing that's interesting with these studies is that we don't see the exact same pattern in the pelvis and in the neck. To understand the reason for this variability, I have to ask you one question. Does an NFL lineman move the exact same way as a ballet dancer? Of course not. They have different physical structures, and because of that, they will move differently. The same is true when it comes to this asymmetrical presentation. Because our physical structures are different, as noted in this study right here, we can't say that this rightward rotation is going to occur the exact same way for every person in existence. This is why you might not fit common patterns that are espoused on the internet. To determine what physical structure we have, we're going to measure the infrasternal angle. This is the angle that's below the sternum or breastbone, and that's on the inner side of the ribs. And according to this study right here, there's a fair amount of reliability in measuring the shape of the infrasternal angle. We're going to talk about two extremes, a narrow infrasternal angle and a wide infrasternal angle. A narrow infrasternal angle is someone that has a more vertical shape of their lower rib cage. When they breathe in and breathe out, you'll notice that the lower ribs move laterally or outward and medially or inward. It looks like elevator doors opening and closing. When someone has this specific ISA presentation, they rotate more above a longitudinal or up and down axis. So that will create a different presentation in the pelvis and in the thorax when we're talking about that rightward rotation. For narrows, they often have a pelvis that is laterally tilted to the right, and then the torso is side bent to the left. Whereas the opposite extreme, a wide infrasternal angle, has a more horizontal shape of their lower rib cage. When you watch these individuals breathe in and breathe out, the ribs move more up and down, like a garage door, opening and closing. Because of this shape, they will turn differently than the narrow ISA. These folks turn more on an oblique axis, so the pelvis will be in a more diagonal position. Oftentimes, you will see a lateral pelvic tilt that is to the left, and the thorax will be more side bent to the right, and those are at the extreme ends. You can have people that are in between, but if you test yourself by lying on your back with your knees bent, and you grab the inner part of the lower rib cage, take a silent breath of air in through the nose and out through the mouth. You'll want to follow the movement of the ribs. If your ribs move more like elevator doors opening and closing, you are a narrow. If they move more up and down like a garage door, you are a wide. How can you be sure if you have this asymmetrical pattern? If you're a narrow infrasternal angle who has a lateral pelvic tilt to the right and a trunk side bend to the left. You will have a loss of left hip external rotation, right hip internal rotation, left shoulder internal rotation, and right shoulder external rotation. A wide who has a left lateral pelvic tilt and a side bent thorax to the right, you will see a loss of left hip internal rotation, right hip external rotation, right shoulder internal rotation, and left shoulder external rotation. Now, if you fit the exact opposite pattern, first, double check your ISA measure, make sure you measured correctly. But if you stick around to the end, I will show you some specific exercises for the people who have that flip-flopped representation and why that happens. For the narrow ISA, we're going to do 3 exercises in a sequence. You'll want to do each of these just on one side for 4 sets, 5 breaths in the order. Do not skip ahead. The first move is a left side lying right knee push. You want to be at about 60 degrees of hip flexion, lying on your left side. Have both feet flat on the wall. Press into the wall at about a 3 out of 10 effort through 2 points, the inner heel and the base of the big toe. Place a foam roller or small ball between your knees. Maintaining that foot pressure, silently breathe in through your nose. Softly exhale through your mouth. Push your right knee forward. Do not reach completely to the end range because you will lose your foot contacts. You want to go at about a 4 out of 10 effort on this reach. We'll work a similar strategy in quadruped on elbows. Keep a 90-degree angle at the hips and the shoulders. Make 2 C's with your hand and rotate them down like you're pouring one out for your homies. Start sagged. Take a silent breath of air in through your nose. On the exhale, you want to gently, at a 3 to 4 out of 10 effort, push your torso up through that wiggly bone on your wrist, called your pisiform, your elbow, and your kneecaps. Maintain this pressure and breathe in through the nose. On the exhale, press your right kneecap into the ground firmly. This will unweight the left side. Hold this position, silently breathe in through the nose, and on each exhale, press a little bit firmer through the right kneecap, completing that hip shift. You'll feel your right glute working if you get it right. Make sure the leg lift is coming from pressing into the ground, not forcing a hip shift up on the left. If you do this, it's not uncommon to arch your back, limiting your mobility gains. The last move is going to torch the right hamstrings like mega, completing the turn. Lie on your back and make sure that your PSIS, the bony part that's on the top of the pelvis, is contacting the ground. Your feet will also be flat, making sure you have weight through the inner heel and the base of the big toe. If you can't feel the PSIS, elevate the feet. Gently press the feet into the ground, maintaining PSIS contact. If you get it right, you will feel your hamstrings working. Lift your left leg off of the ground. Grab your shin with your left hand. Your right hamstring ought to be cooking at this point. Hold this position, breathe silently in through the nose and softly through the mouth. If you have a wide infrasternal angle, you'll want to try these 3 moves. This first one is called a right low oblique sit. Lie on your right side. Make a C with your hand and rotate your palm downward, keeping weight on the pisiform, which is the wiggly bone that's on the pinky side of the wrist. The other weight-bearing point will be the bottom outside knee. Take your top arm and leg and reach them both forward, which will increase the weight bearing through those 2 points. Looking straight ahead, you want to silently breathe in through the nose. On the exhale, gently push your torso up through those 2 points, keeping it at about a 3 to 4 out of 10 effort on your push. Maintain that pressure and breathe in through the nose and out through the mouth for 5 slow breaths. This next move is a hip shift on your back. Keep weight on the PSIS, which is the bony part on top of the pelvis, the inner heel, and the base of the big toe. If you can't keep the PSIS on the ground and you have to force it, elevate your feet. You're going to gently press down on those foot points without losing contact on the PSIS. Silently breathe in through your nose. On the exhale, press your feet down without losing PSIS contact. If you get it right, you will feel your hamstrings working. Take another breath of air in through the nose. On the exhale, you want to push your right knee forward and your left knee back. This will increase muscle activity on the right glute and the left inner thigh. Keep all of your weight on those foot points and the PSIS. Hold this position 5 slow breaths. Do not make the mistake of overshifting and losing the foot contacts. Keep the shift at about a 3 to 4 out of 10 effort. The last move is a left side lying right wall push. Lie on your left side, have your top leg at a 90-degree angle at the hip and the knee. Your right foot will be resting on the wall. Relax your head onto a pillow or pads. Take a silent breath of air in through the nose. On the exhale, press into the wall with the right foot through the inner heel and the base of the big toe at a 3 to 4 out of 10 effort. Keep the foot flat as you press. Do not allow it to tip. Now, if you're the person whose measures appear flip-flopped and you're pretty sure you got your infrasternal angle correct, then what's likely going on is you have increased superficial muscle activity that is beyond what we would normally see with these structural presentations. You are going to need exercises that do a better job of getting those bigger muscles to relax. Grab a foam roller, place it on the middle third of the rib cage. If it's too uncomfortable, put a pad over the foam roller. Rest your head on some pillows. Take your top arm and leg and roll them forward so that way it log rolls your torso. You want your torso and the zipper on your pants parallel to the wall. Your top arm is then going to go in an abducted position, which will keep it in line with the thorax. Silently breathe in through the nose. On the exhale, softly melt down into the foam roller. Perform this move for 4 sets of 5 breaths per side, 2 times per day. We can use the foam roller also on the pelvis to reduce muscle activity. Place the foam roller on the top part of the pelvis. Rolling your torso and pelvis forward, silently breathe in through the nose, and on the exhale, think about melting down into the foam roller. Do that move for 4 sets of 5 breaths per side, 2 times per day. And this last move is an absolute ab burner. Lie on your back and place one of those big exercise balls between your shins and your hands. You'll weight bear through the PSIS, which is the bony part atop the pelvis, and in between the shoulder blades. Have your feet together with your knees slightly apart. Apply a 3 to 4 out of 10 pressure into the ball with your arms and your shins. Take a silent breath in through the nose. On the exhale, you're going to shift your weight to one side, keeping it even between the PSIS and the upper back. Hold this position on the inhale, and then on the exhale, you're going to shift to the other side. Hold on the inhale and shift back and forth. You want to do 2 to 3 sets of 5 to 8 shifts per side, 2 times per day. Now, if you've done these moves for about a month, and you're still noticing some issues, there might be some other moves that you can apply to some of these mobility restrictions. In this video right here, I go into some of my favorites for addressing some of these imbalanced postures, especially in the pelvis.